A friend of mine who is self-identifying transgender person and visible transgender person, she went to a pharmacist and she asked for the sanitizer, and this shopkeeper makes fun of my friend and says like, "आप जैसे लोगों को virus कैसे लग जाएगा?"
Many trans persons actually die out of sheer delay in terms of understanding where to put them. Should they be put in a male ward? Should they put in a female ward?
When it comes to an outbreak like situation in terms of coronavirus, where many patients are competing for limited healthcare resources, then naturally one of the groups which will get least priorities in terms of access and availability of the healthcare facilities would be the transgender groups.
So transgender persons whose livelihoods depend on going outdoors are going to find it far more difficult, and the larger healthcare system, which is extremely discriminatory and exclusionary, is preventing many transgender persons from coming forward to try and get tested.
You understand how people treat you just because you are different for them, so virus can't touch you. Or you are just not worth to get a proper hygienic and a proper good treatment and information about this virus.
Specifically speaking about the effect of coronavirus infections on the transgender persons, then we need to understand that a lot of transgender persons are having let's say lower levels of health as compared to the general population because of neglect of their own physical and mental health. We all know that the transgender community is at a higher risk of getting HIV.
Transgender persons who are trying to access hormonal therapy, say any other kind of medical service, say therapy with a mental health professional, is finding it difficult because we're trying to isolate ourselves, and while we are trying to stay indoors, most of our abuse also comes from our homes. So accessing therapy becomes critical sometimes.
The majority of the transgender community, like the majority of non-transgender communities, are working class. The idea of sort of social distancing, working from home and so on are very, very privileged ideas, and this will essentially render a lot of people in transgender communities hungry and unable to sustain themselves.
If the separation wards or the isolation wards, they have the male-female binary gender facilities, and there is no trans person, be it for trans women, be it for trans men, then it becomes extremely difficult for a trans person to access that kind of healthcare, because we have seen in past that many trans persons actually die out of sheer delay in terms of understanding where to put them. Should they be put in a male ward? Should they put in a female ward?
We'll have to try and educate less privileged trans persons and everyone else, and that is going to only happen when we are trying to make the healthcare system far more inclusive, far more friendly, and at this point make all that information accessible in multiple languages. And know for a fact that all these testing centers are openly, if they declare themselves as trans friendly, that is going to make a hell of a difference.